Hello and welcome. I'm Dr. Alvaro Garcia, and I would like to talk to you today about ventral hernias. What's a ventral hernia? A ventral hernia is a hernia that occurs in the previous incision from a previous surgery. Generally, the patients complain of a bulge or pain in the area. What are the risk factors for a ventral hernia? The most common factor is an increase in the abdominal pressure. That occurs when you lift something really heavy. The other factors are genetic. There is changes or difficulties in the closure of the incision, on the maintenance of the incision over time, and that can lead to the tissues to be pulled apart and create a hernia. How are hernia repaired? The hernia can be repaired in an open, laparoscopic, or robotic-assisted fashion. For the most part, complex ventral hernias require an open repair. If the hernia is relatively small, it can be repaired laparoscopically or robotic-assisted. In the open ventral hernia repair, we use what it's called a flap creation, which means there is a relaxation in the muscles nearby the muscles that are going to be repaired. And these hernias, as they can be large and require a little bit longer recovery time, to decrease complications, I use biological mesh. What's biological mesh? It's a mesh that, after being placed against the tissues after its repair, is capable of incorporate itself to the abdominal wall. When that happens, the abdominal wall remains stronger and it feels normal. What is the recovery time for a ventral hernia? Generally, patients might or might not necessarily need to be hospitalized, but the first few days after the surgery, the patients have to be very careful, and within a few weeks, the patients can recover normal activities and find themselves back into their works or their regular and usual things they do daily. Again, if you have any questions about ventral hernia repair, mesh, or its recovery, please call us to the number that you see underneath the screen or send us an email and we'll get back to you. And again, thanks for listening.